Have you recently opened a medical portal to read your MRI report only to see the terrifying phrase, Degenerative Disc Disease? Does your lower back ache with a dull, continuous pain that suddenly flares up into severe, paralyzing muscle spasms without warning? When you sit at a desk or drive a car for an extended period, does the pressure in your lower back become agonizing, forcing you to stand up just to find relief? Have you experienced a sudden sensation that your spine is giving out, as if your back can no longer support your own body weight? If you checked these boxes, you are likely trapped in a cycle of fear. The word disease implies an infection or a cancer that will inevitably spread and put you in a wheelchair. Take a deep breath. You have been misled by a terrible medical term. Degenerative disc disease, also known in Europe as osteochondrosis, is not a disease at all. It is a predictable, mechanical cascade of structural failure. And once you understand the physics of this failure, you can stop the pain. To understand why your back is locking up, you must look at the microscopic engineering of your spine. Between every bone in your spinal column sits an intervertebral disc. This disc is a heavy-duty hydraulic shock absorber. It consists of a tough, rubbery outer wall called the annulus fibrosus and a soft, pressurized, gel-like center called the nucleus pulposus. In a healthy spine, this gel center is composed of 85% water. It acts like a plump, wet sponge, allowing you to run, jump, and bend while perfectly absorbing the impact. But human spinal discs have a massive design flaw. They are completely avascular. This means there are 0 blood vessels penetrating the center of the disc. So how does the disc stay alive? It is sandwiched between 2 layers of cartilage called end plates. These end plates act as microscopic filters. When you move your body, the physical pressure changes inside your spine. This pressure acts like a pump, slowly sucking oxygen, water, and nutrients through the end plate filters and into the disc. This process is called imbibition. If those end plate filters become clogged by age, trauma, or poor metabolism, the pump stops working. The disc begins to starve. The wet sponge rapidly loses its water content and transforms into a dry, brittle cracker. It flattens out, loses its height, and no longer can absorb the mechanical shock of your daily life. This biomechanical reality exposes the most dangerous myth in chronic back pain management. When patients feel the severe ache of a degenerating disc, their first instinct is to lie down in bed and stop moving entirely. They stop walking, they quit exercising. They believe that resting will protect the spine from further damage. This is a catastrophic mistake. Remember the physics of the disc. It has no blood supply. It relies entirely on physical motion to pump nutrients through the end plates. If you lie perfectly still on a couch for weeks, you are physically starving the disc to death. The lack of motion prevents oxygen and water from entering the tissue, accelerating the dehydration process. Furthermore, your core and spinal muscles rapidly weaken from inactivity. When these supporting cables weaken, all the gravity and stress of your upper body crash directly down onto the dying, brittle disc. You cannot heal a starving disc by immobilizing it. You must use controlled, low-impact mechanics to feed it. You cannot diagnose the exact stage of this failure by taking a basic X-ray. An X-ray only shows the shadows of your bones. To see the true health of the hydraulic system, we must act as medical detectives and use a high-definition T2-weighted magnetic resonance imaging scan. When an elite neurosurgeon looks at your MRI, we are evaluating the exact water content of your spine. Water shows up as bright white on a T2 MRI. In a healthy 20-year-old, the spinal discs glow brightly on the screen. But when a disc starves and dehydrates, it loses that bright signal. On the screen, it appears pitch black. In radiology, we call this desiccation, or the black disc phenomenon. We measure the exact loss of disc height. When a black disc collapses, the two vertebrae bones move closer together. This narrows the tunnels where your spinal nerves exit. It also creates abnormal friction. But a black disc alone does not automatically mean you need open surgery. We must determine if that specific disc is generating your pain, or if it is just a silent marker of your biological age. To determine how to treat your pain, we must map exactly where you are in the Kirkcaldy-Willis Degenerative Cascade. This is a sequence of 3 distinct phases that a dying disc goes through over the course of 10 to 30 years. Phase 1 is dysfunction. The outer rubber wall of the disc begins to develop microscopic tears. The highly toxic inflammatory proteins from the inner gel begin to leak into the outer wall. If these chemicals touch the surrounding nerves, they create a chemical fire. You experience localized pain, stiffness, and severe muscle spasms. Phase 2 is relative instability. The disc continues to dry out and aggressively loses its height. The wet sponge is gone. Because the disc is flat and deflated, the bones above and below it begin to wobble. They shift and slide unnaturally. This micromotion instability triggers intense stabbing pain flare-ups. Your back muscles go into violent, debilitating spasms to try and clamp the wobbly spine in place. This is the most agonizing phase of the condition. Phase 3 is restabilization. The human body recognizes the dangerous wobbling and attempts to build its own internal cast. It deposits calcium to grow massive bone spurs or osteophytes around the edges of the dead disc. The body is literally trying to fuse the bones together. In this final phase, the micromotion stops, the inflammatory proteins burn out. The sharp, volatile pain usually subsides into a dull, chronic stiffness. You lose your flexibility, but the severe flare-ups eventually stop. Because degenerative disc disease spans decades, your treatment must perfectly match your exact phase in the cascade. We do not use a one-size-fits-all approach. If you were in phase 1 or 2 and the dying disc is bulging outward and pressing on a spinal nerve, we do not immediately reach for heavy metal screws. We utilize advanced, minimally invasive interventions. We use techniques like percutaneous laser disc decompression. Under local anesthesia, we guide a microscopic laser fiber directly into the center of the black disc. We vaporize a tiny fraction of the dead tissue to lower the internal pressure. This stops the bulge from crushing the nerve and drastically reduces the inflammatory chemical leaks. If you are in phase 3 and the collapsed disc and massive bone spurs are physically choking your spinal cord, laser decompression will not work. We must use precision microsurgery or endoscopic techniques to physically shave away the overgrown bone and widen the nerve tunnels. If the spinal segment is completely destroyed and causing severe neurological weakness, we offer advanced artificial disc replacement to restore your natural motion, or an ultra-minimally invasive spinal fusion to permanently lock the unstable bones and eliminate the grinding pain forever. A diagnosis of degenerative disc disease does not mean your life is over, and it does not mean you will end up paralyzed. It simply means a mechanical shock absorber is failing. But you cannot stop the cascade by ignoring it, and you cannot rebuild a black disc by swallowing generic painkillers. You must identify exactly how much mechanical space is left in your spine. Stop guessing about your future. Let our expert neurosurgeons review your medical imaging. Click the link in the description to upload your MRI or CT scans to our secure portal. We will examine the water content of your discs, map your exact location in the degenerative cascade, give you a definitive second opinion, and build a highly targeted plan to stop the breakdown of your spine.